All right, I'm a hand talker, so if you can't hear me, just wave. All right, gang. Okay, so let's chat today about climate action, health, and designing a more environmentally sustainable health system. Because how I bring climate action to work is through design and advocating for healthcare that's better for people and the planet. So as temperatures increase across Canada, so will the negative health effects. Illnesses from heat, air pollution, and vector-borne diseases, injuries, and fatalities from extreme weather events. So many of these are happening now, and some of these you may have personally felt. For me, the first time that I felt the fear of climate change was when I was 14. I'm from Kelowna, British Columbia, and I grew up in the mountains. Yeah, BC. 2003 was a really dry year in our forests, and there's a whole reason that's climate change as to why that was. But long story short, lightning hit a tree on Okanagan Mountain, and a massive fire broke out that destroyed huge swaths of forest and neighborhoods in my community. So as a result of this, I ended up in the doctor's office with an asthma attack. And I remember feeling scared and feeling sick and feeling like my world was burning down. So years later, I see that what I experienced was my physical and mental health were impacted by climate change. And I'm not alone. Every day in Canada and across the world, people are similarly impacted by climate change. So now that I work in health, I really see that the healthcare sector we stand on the front lines of climate change. So the impacts of these diseases and injuries from climate change show up in our emergency rooms, our doctor's offices, and they really drive the need for public health policies and interventions that are responsive and resilient to a lot of the challenges that we face. However, despite this reality and healthcare's mandate to do no harm, we are also major contributors to greenhouse gas emissions, which ultimately harm the planet. So in fact, Canada has the third highest per capita greenhouse gas emissions from healthcare in the world, and healthcare accounts for approximately 4% of our total carbon emissions. So globally, if the healthcare sector were a country, we would be the 5th largest emitter on the planet. So the majority of our emissions come from the healthcare supply chain and producing, transporting, and ultimately disposing of the things we use every day, such as syringes, pharmaceuticals, bandages. Then there's some emissions from our healthcare facilities and vehicles, and then indirect emissions from purchased energy sources. So in the face of the climate crisis, climate action in the healthcare sector really demands us to truly do no harm and transform our health systems to be more environmentally sustainable, while also providing quality of care at a reasonable cost. Easy, right? So how do we do that? It's on the other side of this piece of paper. I got it, guys. Okay, so you can check out Healthcare Without Harm for a full rundown on the amazing leadership that hospitals are showing in this area. But I'm going to level with you. I have a public health background, and that has hardwired me to always think of prevention first.
Woo! Yeah.
Because the most effective way to decrease the environmental impacts of our health system is to minimize the need to use carbon-intensive health systems in the first place. So how do we keep people healthy and out of hospitals? So part of the solution lies beyond healthcare. We need people-centered policies that support the design of healthy communities. So this includes things like food security, affordable housing, accessible healthcare, community green spaces, and infrastructure for active commuting. Because walking or biking, active commuting alone will reduce your risk of heart disease while reducing your carbon footprint. So another major part, though, of transforming health systems to be carbon neutral, it really lies in us in healthcare, adopting user-centered design principles to create better care in the community that lessens our reliance on hospitals. So in hospitals, in healthcare, we often talk about patient-centered care. That's care that is respectful of individual patient preference, needs, and values. And for me, this has always been a wide open door to user-centered design. So my current work has been in designing e-health services for people requiring long-term medications. Think diabetes, cardiovascular disease, or right now I'm working with patients who have tuberculosis. So these are all things that require you to consistently take medications over a long course of time, or else you're going to end up in the hospital. So what we do is we use user-centered design to create digital health services to help them or their caregivers manage their medications and their illnesses in the community without having to travel. So one tuberculosis program in the US, they found that switching from in-person visits to video chat saved around 2,000 kilometers of patient travel over the 6-month course of treatment, which in total saved 14,000 kilometers of travel, or 2 tons of carbon. So the video call patients were also happy with the services they received. 95% of them adhered to their medication. That was great. This was only for one small program for one disease in one community. So imagine the possibilities, right? But of course, all of these benefits, they hang on good design and creating services that patients want to and are able to use. If they face usability or other barriers to use, then they're just going to end up in a hospital requiring that carbon-intensive healthcare again, right? So if we want to reduce our environmental impact, we really do need to design as if we are in a climate crisis. And in my line of work, that means that we need to ambitiously pursue models of care and create health services where patients can live healthy lives within their communities. So as a parting thought, because I have a microphone and I've gone over time, but I want you to know, I really encourage you all to take this great ideas and all of the energy that we have here tonight, and I want you to use it to reflect. And I want you to think more broadly about what it means to act like we're in a climate crisis, and think more deeply about how you can use design for transformational change within yourself, within your workplaces, and then ultimately within our community. Thanks, everybody.
Woo!